Hi, I'm Olivia Patchell. I'm the Family and Consumer Science Extension Agent for Currituck and Camden counties, and I'm joined today by Sheila Gregory, our Family and Consumer Science Program Assistant for Currituck County, and she's going to be making a healthy Mediterranean tuna salad. Before we get started with her, I just wanted to remind you that we have linked the recipe in the comments section, and it will scroll along the bottom, the link to that recipe, as well as the link to the Med Instead of Meds website. So I'll refer back to that a little bit later. So let's go ahead and see what Sheila's got prepared for us. So this Mediterranean tuna salad is actually a little bit different. So we're actually getting cans of tuna packaged in water or olive oil. So you want to make sure that you read the labels for that. You'll add carrots that you've minced, celery that you've minced, and yellow bell peppers that you've minced. The recipe on the Med Instead of Meds website, or the one that we have linked, actually tells you how many of each of these to buy. So when you go to the grocery store, you're not guessing. You'll add red onions and either olives or pickles. We're adding pickles today to our recipe just out of preference. So add what tastes good to you. Then as our binding, we're adding olive oil rather than mayonnaise, making it a little healthier, lower in cholesterol. Utilizing a vegetable-based fat rather than an animal-based fat. And then for our seasonings, we're using black pepper, cayenne pepper, and salt to taste, which is also optional if you do not like too much salt or would like to reduce your sodium. So we're going to add these all to a medium-sized bowl and mix them up well. While Sheila's mixing those up and letting that kind of marinate, I wanted to talk a little bit about heart health. So February is Heart Health Month. And actually on Friday is Go Red for Women's Heart Health, because stroke and heart disease disproportionately affects women in America. So let's talk about some of the stats. 121.5 million, or that's around 47% of U.S. adults have hypertension. Hypertension is something that can usually be controlled through medication or with lifestyle changes. So that's something that we call a chronic condition, or a condition that we can or treatable condition. Approximately 1 in 4 U.S. adults have actually reported that they are receiving adequate time to do aerobic or muscle strengthening activities to meet the physical activity guidelines. So the USDA recommends that we get 30 minutes, or adults get 30 minutes a day, 5 days a week of physical activity, with 2 days of muscle strengthening activity working the major muscle groups. So only 1 out of 4 adults is getting that. 1 in 6 males and 1 in 8 females currently are smokers in the U.S. And so this all attributes to our cardiovascular disease problem. On average, someone dies of cardiovascular disease every 36 seconds in the U.S. And so that equates to about 2,380 deaths of cardiovascular disease each day. And then on average, someone in the U.S. has a stroke every 40 seconds. And of those people that have strokes, every 3 minutes and 33 seconds, someone will die of a stroke in the U.S. So that's a lot of information to talk to you about cardiovascular disease and how important it is to take care of your heart and your body. So if you're asking yourself, how do I do that? So I have some recommendations from the American Heart Association. They encourage eating a balanced diet, maintaining a reasonable body weight, staying at least moderately physically active, and that would be within the limits of your cardiologist if you have one. Check your cholesterol levels regularly, so make sure that you're having those annual checkups, and especially if you have a history of heart disease in your family. We want to avoid smoking. Get regular medical care from your primary care physician, as I mentioned, and then take care of your dental health. So dental health is always linked to heart problems with your heart, and especially linked during pregnancy. There are also some other recommendations that maybe your cardiologist or an endocrinologist might make for you. So we'll make sure we want to follow those recommendations, as well as taking medication as prescribed by your physician. So again, let's switch back over to Sheila, see what she's got on the plate for us. She is going to plate us up some of that delicious tuna salad onto a bed of lettuce. We also have some olive oil toast. That just means we spread some olive oil on the toast instead of butter, so lowering that cholesterol level and then toasting it. And then we have some cucumbers as an alternative to the toast and allowing that crunch without the added carbohydrates and getting in an extra serving of vegetables. So I'll close out today reminding you that Friday is National Go Red for Women's Heart Health. We want to make sure that we take that day to just kind of get an idea of what's going on as far as our heart health is concerned, or what's going on in the world with heart health, so that we know how much we should worry about it. Take an inventory of your lifestyle. The American Heart Association is actually doing a Get Back in the Rhythm or kind of campaign, and that is something that we can revisit from when we went home during COVID. Maybe our rhythm went out of sync, and actually we saw a spike in cardiovascular disease beginning in 2020. So we would like to get back in the rhythm of taking care of our bodies, making time to be physically active, making sure that we're eating the fruits and vegetables that we need to maintain a healthy, well-rounded diet. And I also encourage you to check out the Med Instead of Meds website. They have tons of delicious, heart-healthy recipes. We're utilizing the Mediterranean way of eating, which lowers your cholesterol, which has been shown to lower cholesterol because of the sources of fat often utilized in these recipes. And we're utilizing techniques that have been shown to lower that cholesterol, decrease blood pressure, and some studies have even shown an increased neural function or decrease in Alzheimer's risk. So check all that out. Check out the information behind all of the information that I showed you there or told you about. There are lots of studies there if you'd like to dive a little bit deeper into why the Mediterranean way of eating is so important to our heart and our brains. And that, again, can be found at medinsteadofmeds.com, or the recipe that we utilize today can be found at medinsteadofmeds.com. If you have any questions, you can contact me at olivia_patchell@ncsu.edu. You can also check our website for upcoming classes and other offerings as far as food demonstrations. We will meet again next week, the first Tuesday of the month at 10. Thank you.